Hello, this is Dr. Bartosh of Proactive Wellness and Injury Center, and I just want to take a few moments to share with you an announcement that was made last Tuesday by the Food and Drug Administration, stating that they were going to start putting warning labels on your statin drugs. Those are in particular Lipitor, Crestor, or Zocor. And on the warning label, it was simply going to state that it may increase your blood sugar levels and or it could also affect you or create memory loss. Now folks, that's just the tip of the iceberg. What they failed to put on the label, and of course if they did put on this label it would be quite large, that the side effects, the taking of these drugs could have serious side effects, which include or could include peripheral neuropathy. That's the burning, the numbness, the tingling that people often complain about in their fingers or in their toes. It could cause muscle damage, some of which would be severe, resulting in muscle pain, disabling fatigue, and in some cases even a severe muscle weakness over long-term use of statins, which would result inevitably in kidney damage, because what happens is as the muscles break down, they release a certain protein that the body has to get rid of, and it has to go through the kidneys to get rid of it. And by doing so, it inevitably damages the kidneys and results in a disease or condition known as rhabdomyolysis. Also, heart failure, because these statin drugs leach from your body CoQ10. It's a very important nutrient for the heart, and over time, this is depleted to the point wherein these people are taking now these statin drugs and developing heart disorders or heart conditions. Now, if you have a pre-existing heart condition and you're on statin drugs, it would behoove you to bring this information to your prescribing physician, because your risk for this is greatly increased with the administration of these drugs. As a matter of fact, there was research done at the East Texas Medical Center, and these patients were put on the statin drug Lipitor for only 6 months, and 66%, 6 out of every 10 of them, developed heart problems that would lead to heart failure. Also, it's an immune suppressor. That means it weakens your body, opening the door to bacterial or viral infections as well. And as I stated earlier, or as they were stating, it's going to increase your risk to develop diabetes. It also affects the mental function and can result in what's known as transient global amnesia, and it increases your risk for developing cancer, not only prostate cancer, but all types of cancers. And I may say this to you also, if you are a gentleman that's obese and you're on a statin drug, it can run the risk of developing a very aggressive prostatic cancer as a result. Also, it can you can develop cataracts, liver dysfunctions, and certain type of rashes. And I want to bring to your attention one advertisement that's commonly seen on the television, and it's for Lipitor. And they state in this advertisement that it lowers the incidence of heart attack death by 30%. Now, in actual numbers, it's lowering the risk from 6% to 4%, which is only a 2% reduction. However, the math that they use for the 2 less than 6 is 30% less. So that's how they advertise. That's what the drug companies use many times to statistically manipulate their advertising and sell you a bill of goods. They also stated that these statin drugs, with their introduction in the 80s, would reduce the amount of heart attacks and strokes. However, folks, it hasn't changed at all to this date. So you may ask, well, what do you do? My suggestion might be to treat your body as you would your house. And if you were sitting at home and the smoke alarm went off, you'd immediately get up or cease whatever you were doing, going to wherever the smoke was at, and you'd put out the cause. You'd eliminate the fire. And God forbid, if your house got on fire, you'd call the fire department, and hopefully this fire department would come with the intent of putting the fire out. Now, how does this relate to the body? Well, when you have a problem, the body sets off a little alarm. It sets off a symptom. It would behoove you at that time to find out what that symptom is related to and eliminate the cause of it. And again, God forbid, if you have a disorder that is a raging fire in your body, then find a doctor whose intent is to put that fire out and not just manage the fire, but rather put it out. I hope this information's been helpful to you. I'd certainly like to hear from you. Any comments that you might have or questions, please let us know. We thank you for listening, and we hope that you have a great day.